Scott, the economic climate is forcing some states to drastically cut spending, including funding for charity health care. Your report focuses on Nevada. What is happening there?
Well, we went to Las Vegas to visit University Medical Center, and the important thing about UMC is that the city of Vegas, about 2 million people, depends on this hospital for so many things. It's the only level 1 trauma center in the area, the only burn unit, the only transplant unit, and it's the major hospital providing charity care in the region. The problem is Las Vegas is falling on the hardest times it's ever seen. It's number 1 in the nation for foreclosures, for example. And so a hole has been blown in the tax revenues of the state of Nevada and therefore in the budget of UMC. So the hospital is having to curtail services that it has provided for many, many years. And one of the things that we focus on 60 Minutes is the story of the outpatient chemotherapy center. That center has closed for all new patients, and so now people who are down on their luck in Las Vegas, and there are more of them than ever before, if they're suffering from cancer, they have no place to go immediately to receive chemotherapy.
And exactly what is the impact on these patients?
Well, as you can imagine, many of the people that we talk to for our story are desperate. They think that it might be a death sentence that this clinic has closed. One of the dynamics of what's happening in Vegas right now is that people who are middle class, making $30,000, $40,000, $50,000 a year, are losing their jobs, and as a result, they're losing their health insurance. Well, if they get more bad luck on top of that and get a cancer diagnosis, before they used to be able to go to University Medical Center and say, look, I have no money, I'm indigent, but I need treatment, and they would be treated with chemotherapy in that clinic. Now that clinic is closed, so they have no place to go. Many of the patients that we talk to are dialing for luck, if you will. They're calling various private hospitals and clinics trying to essentially beg for chemotherapy care. It's one of the symptoms of the recession and a very disturbing one.
And is this type of healthcare crisis spreading to other states?
Well, the hospital administrator that we talked to at University Medical Center in Las Vegas told us that this is happening to many county hospitals all across the country to varying degrees. The budgets are getting hit, services are being curtailed. But she felt that it was probably happening to University Medical Center more than just about anywhere else because, as she put it, Las Vegas has become the epicenter of the national economic crisis.